Namaskaram. I welcome you all for today's uh, series of session, Ayurveda session on Dinacharya, the daily regimen for healthy living. So here we have today our Ayurveda expert, Dr. Umesh.
Namaste.
He is working as a scientist C in a Department of Integrative Medicine at NIMHANS. So he will be discussing the aspects of Dinacharya that you could follow in this period to enhance your well-being and your health. So I give over the session to Dr. Umesh.
Thank you, Dr. Nishita. Namaste. Today, we will be discussing on Dinacharya, that is the daily regimen for healthy living. So, this is one of the unique concept that Ayurveda has given. So, I think Ayurveda was the foremost science to give such a concept where whatever all the daily regimes that one has to adapt has been explained for the benefit of human for maintaining the health. So you know that Ayurveda is a science of living, and the main aim of Ayurveda is to bring about balance of the body and also the mind. So bringing balancing of the humors of the body and the humors of the mind is the main aim of Ayurveda, and for which this uh, balancing has been told in sense of two ways. That is for the maintenance of health, that is for healthy living, and also for the cure of the disease. Today, we will see whatever all the aspect that is being told for the prevention of disease. So especially for preventing, certain daily regimes have been told for the balancing of the humors of body and mind. So we will one by one try to see them, what is their importance, and how by adapting them we will be able to uh, lead a healthy life and prevent certain disease aspects, at least prevent the diseases to a greater extent. So coming to the introduction, so you all know that prevention is better than cure. So it's a famous quotation, and Ayurveda gives a special importance to maintenance of health of a healthy person and curing disease of an ill. So this we have discussed that bringing about the balance of the body and mind in the sense of healthy living and also in a diseased person is the main aim. And a daily routine is necessary to bring a radical change in body, mind, and consciousness. So this is very much important. If you don't have a daily routine, then especially our routine becomes very haphazard, and this would have its own effect on the both body, mind, and on our consciousness. And daily regimen regularizes a person's biological clock. So once we adapt that daily regimen, our biological clock set to it aids digestion, absorption, assimilation. That is, the digestion improves, absorption improves, and assimilation improves. It generates a self-esteem, discipline, peace, happiness, and longevity. So appropriate daily regimen serves as a foundation of healthy life. So we need to have an appropriate daily regimen, and that daily regimen forms a basic foundation for the healthy life. So now let's see what are all those daily regimens that has been prescribed in Ayurveda. So most of them we will be already practicing in our daily life. We may see when we go through the slides, we may feel that what's the new in it, we are already practicing it. But this was a unique concept which has been put forward by Ayurveda ages back, and a proper, whether we can cross check whatever all the daily regimens that we are doing is right, wrong, where to correct, and what to do. So taking those things today, we will be going further ahead in the different aspects of the daily regimes. So Ayurveda recommends daily regimes in order to lead a healthy and a disease-free life. So what are those daily regimens? So the first one is Brahmi Muhurte Uttishte. So that is early awakening. So that is waking early in the hours, that is before the sunrise, especially in the Brahma Muhurta. The second part is Ushapana. So here Usha signifies the light. So once we wake up, so what is the type of drink that we need to take? So some impregnated water that would be there that we need to consume. So how much to consume? So how to store that water, etc. The next one is Malotsarjana regarding defecation. So what are the benefits, etc. Achamana, that is washing the hands and face. So what are the benefits of it? Dantadavana, that is brushing. So what are the benefits of the brushing? What are the different accessories that are being needed for, that is that the things that are used for brushing? Jigva nirlekana, so what are the benefits of scraping of the tongue? Anjana, application of the colorium. So why it should be applied, when it should be applied, what are the things that can be used? Nasya, that is nasal installation. Ghandusha dharana, so retaining of certain fluids for the gargle or like an oil pooling. Abhyanga, massage. Vyayama, exercise. So what should be the extent of exercise? What is the type of exercise that need to be adapted? Snana, bathing. When the bathing has to be done. So what are the contraindications for bathing and what are the benefits of bathing, etc. Anulepana, that is smearing the body with the fragrant drugs or the materials. So Vastadharana, wearing appropriate apparels. Gandhamalya dharana, that is wearing symbols of auspicious. So these were the certain things that were being given in Ayurveda, and today also as a tradition that is being followed by us. And Bojana, the aspects of food intake. So what should be what type of meal that should we take, and how much we should take, and how we should take, all those things we'll discuss in the Bojana. And Tambulasevana, which is a tradition that has been followed in India for ages, that is the betel leaf, etc. So what are the contents of betel leaf? Why? Because today we have a misconception regarding Tambulasevana. So we need to have appropriate knowledge about Tambulasevana, what should be the ingredients and what are their benefits. And lastly, we'll be discussing regarding that of the Sadvrutta, that is code of conduct. So first we'll discussing regarding that of the Brahmi Muhurte Uttishte. So that is Brahma Muhurta. So this is waking up very early, that is before the day breaks. So what is that exact time of Brahma Muhurta? So the exact time of Brahma Muhurta is the last part of the night. So exactly at around 1.5 hours before the sunrise. And after awakening, one should remember Lord Vishnu and see birds, ghee, bilwa tree or mustard seed. So this according to the aspects to the preferable, that is, according to the religion. So whatever all the symbols of special spiritual purity is there, so one can wake up and he can see those things. So it acts like it's a purity, and it causes some purity in mind, and it causes some vitality to the body. So here the word Brahma itself signifies knowledge. So here it is taken as Brahma Jnanam. So Brahma himself is a knowledge. Padartham Jnanamati Brahma. Tasya yogo yogyo Brahma Muhurta Brahma. So that is, it's a special time that is being indicated to receive knowledge or for adhyayana. That is Tadartham Adhyayanamapi Brahma. So it is an appropriate time to receive the knowledge and to gain the knowledge. So, and that's why a person who is interested or who wants to receive more knowledge or getting more knowledge has to wake up in Brahma Muhurta, and he has to go through the scriptures or the books. So the grasping would be more. So why? Because at this state, the Sattva Guna will be more, and the receptive sense organs and buddhi, that is, that there will be a clarity in comprehension and cognition. And by waking up in Brahma Muhurta, it promotes the lifespan and maintains health. And Ayurveda also tells that it boosts the Vedic Shamatva, that is the immunity. So there are certain scientific basis for this to tell, where science tells that melatonin stays low during this hour. So melatonin is an hormone which helps in sleep. So, but during the Brahma Muhurta, this melatonin goes low. So there will the awakening will be seen, and as this and other hormones which are helpful or which help to maintain or the focus, energy and alertness throughout the day will be rising. So that's why it is very important to wake up during the Brahma Muhurta. And one more study tells that late rise from the bed tempts lethargic mood all over the day, causing inactivity. So if one individual has to stay very active throughout the day, so Brahma Muhurta would be ideal time for awakening. And early rising resulted in a significant improvement in the next course of digital subtraction tasks and verbal and spatial memory tasks, indicating enhanced performance in attention and memory. So this was one more study conducted on an healthy individual. So waking up in Brahma Muhurta, so it improved it gave a very significant improvement in the digital subtraction task and verbal task and spatial memory task. So the next one is Ushapana. So once waking up from the bed, so many of us have a habit of having bed coffee, tea, etc. But that would not be a very preferable thing. So substituting it, Ayurveda is recommended to have Ushapana. Here, Ushapana is the water that is being stored in the copper vessel. So a water kept overnight in the copper or a brass vessel is an ideal. So ideally a copper vessel can be selected, and the amount of water that will be consumed should be approximately around 650 ml. And this water should be consumed after awakening. So what are the benefits? So it helps in the proper vacation of bowels, and it balances the dosha. That is, all the three doshas will be balanced by this Ushapana. And once there is a balancing of dosha, that state itself will induce health, and that will help to prevent an individual from suffering from many diseases. And studies also suggest that copper is a natural purifier, and copper, a trace element impregnated water, is a rejuvenator, antimicrobial, antioxidant, anti-carcinogenic, and anti-inflammatory, possesses anti-inflammatory properties and helps neutralize the toxins. Probably nowadays you might be seeing different types of copper, the related articles are coming now, and even RO, a storage unit, is coming with a copper. So slightly the things are changing, and a study concludes that a water stored in a copper container for 16 hours, here the water will be slight, that is, there is a slight increase in the pH, so it maintains the pH of the water, and physicochemical parameters remain unchanged, and the copper content will be 177 plus or minus 16 particles per billion, and this is the as per the standards recommended by the World Health Organization. And it has been concluded that storing water in a copper vessel acts as a microbial purification for drinking purposes. Next is Malotsarjana. So this is very important. So why? Because the digestion, assimilation and appetite indirectly depends upon the Malotsarjana, and Malotsarjana has to be done in the early hours, and it should not be prolonged. So Ayurveda has contributed one unique concept, that is regarding the suppression of natural urges. So Malotsarjana or defecation is one of the natural processes which should not be withheld. So developing habitual early morning defecation is the best way for health promotion, and Ayurveda recommends early morning defecation, and untimely or irregular defecation results in constipation, GI disturbances, calf muscle cramping, abdominal distension, etc. And when it comes to that of a position, squatting position is told to be as the best position, and it helps to create a necessary pressure when compared to that of the Western style commode. But there are certain conditions like where osteoarthritis, etc. So where then according to the preference, that the style the defecating style can be preferred. And one of the study suggests that there is a positive correlation between the suppression of natural urges and incidence of the neurohormonal changes. So suppression of natural urges has resulted in neurohormonal changes which directly impacts the health. So hence, the defecation has to be in proper time, and Ayurveda recommends the early morning defecation. And next is the achamana, that is washing of face and eyes. So cleanliness is what the importance is being given over here by the acharyas, that is the sages. So where after the Malotsarjana, they have uh, stress regarding that of the washing the hands, face and the eyes. Apart from this, they have also given different timings where achamana has to be done. That is before having food, after having food, after yawning, after laughing, after sneezing. So these, and even after touching the animals. So these are the certain time periods where acharyas have recommended to wash the hands. And probably now washing hand has been we are daily as a part has become a routine part of a regimen at the continuously due to the contacts that we come repeatedly, and to avoid the contamination reaching or uh, the infective materials reaching the eyes, the mouth, etc. Hand washing is very much necessary. Next, coming to that of Dantadhavana, that is toothbrushing. So in olden days, twigs were preferred for the brushing, and the twigs that were being preferred in those days would possess astringent taste, pungent, and the bitter taste. That is, we call it as kashaya, katu, and tikta. So especially the twigs that were preferred were we are using acacia, pongamia, neem, magnifera indica, terminalia arjuna, CZ, and jasmine. And nowadays, when we see the different herbal paste, most of the herbal paste contains them as an ingredients. And the preferred size would be around the 12 to 15 centimeters, and the individual has to chew and crush the front part, and later he has to brush. And the acharyas have recommended to brush horizontally rather than vertically in order to prevent the injury to the gums. So when, when we if we are not able to prefer the twigs, so either the brushes can be used where different herbal powders or the herbal toothpaste can be utilized for the things. And Ayurveda has recommended this should be done twice. That is, one after waking up, and second one is after having the food. And there are certain studies compared with that of the toothbrush utilization of the toothbrush and also the utilization of the twigs. And it has come to a conclusion that chewing sticks have revealed parallel and at times a greater mechanical and chemical cleansing of oral tissues as compared to that of the toothbrush. That is, even using the twigs as equal results compared to that of the toothbrush. And miswak, the common twig that is being preferred for the brushing, was found to be more effective than a toothbrush for reducing plaques and gingivitis. And coming to that of the, we might have a debate on what would be the type of toothpaste to be used. So studies have been done with comparison of the herbal toothpaste with that of the conventional. So where there was no significant difference between the herbal and the fluoride toothpaste on plaque and gingivitis. So it has a similar results. And one more study confirms that herbal paste do not alter the pH of the saliva, which is very much important. So where saliva itself acts as salivary enzyme, that is, it contains enzymes which are very much important for the digestion and the protection of the mucus. So I think either twigs or the herbal toothpaste which are containing the ingredients where the common ingredients like acacia or arjuna, etc., can be utilized for the toothbrushing. Next, jigwa nirlekana, that is tongue scraping. So in olden days, for tongue scraping, the scraper that was preferred was prepared by either gold, silver, brass and copper, or even the soft sticks of the plants were used. So basically, it improves the functions of bodhaka kapha. So when we scrape, uh, the collection debris over the tongue is removed, and this helps the bodhaka kapha. See, the bodhaka kapha is situated in the tongue, and this is a type of kapha which helps in the perception of the taste. So by this, the taste perception increases, and the appetite also improves. Once there is a good taste perception, it also improves the appetite and the organism. And one more thing, it cleanses the tongue, by which the organisms in the tongue which contribute to the halitosis, that is the bad breath and the tooth decay, will be eliminated. And dental studies on tongue cleansing have also evaluated the effect on reducing halitosis, coated tongue, or bacterial flora in saliva and on this. So by regular tongue scraping, so it reduces the bad breath, it reduces the tongue coat and the bacterial flora which contributes for the decaying of the tooth and the bad breath. And in a study, it was concluded that tongue cleaning is maybe effective method to improve the digestive power and oral health related quality of life. That is, in these subjects, the oral health related quality of life improved to a greater extent on tongue scraping. So all these methods effectively like help to clear the uh, or help effectively help to maintain the healthy and hygiene of the sense organs. So especially we talked about the oral cavity, mainly regarding the oral cavity till now we have covered. So all these methods helps to keep the oral hygiene, so by which one can have prevent certain diseases to which would which have a spread to that of the oral cavity. Next is coming to that of the Anjana. So this is medical medicine, that is applying a medicine as an eyeliner. So the different types of coloriums were being used in olden days for improving the eyesight and also to maintain the healthy status of the eye. So eye is compared to that of the sun. Like in a when we see a sky, and when the sky is covered with the clouds, and we see the interruption in the sunlight. That is, we are not the sunlight will be dim. Similarly, eye, as it is being located in the head is the sthana for kapha. So there is every chance that the diseases of kapha will be there. The eyes are repeatedly susceptible for the diseases of kapha. So in order to clear it, that the coloriums or the medicine should be applied as a eyeliner. And as Agni Mahabhuta is very predominant in the eye, so Agni Mahabhuta is the one which helps to have a sight, that is to impart a good sight. Application of the coloriums helps to clear these kapha and it improves the vision. So Ayurveda recommends to put Saviranjana, it's an antimony. It should be applied daily. So by applying the antimony over the eyelids or as an eyeliner to the eye, it improves the eyesight. And one more, colorium that is prepared out of Berberis aristata, that is Rasanjana, should be applied once in 5 or 8 days in the night. Especially this type of the eyeliner or the colorium is applied to cleanse the eyes. So once it is applied, so it causes watering to the eye through the eyes. That's why it is told to be applied in the nights. So why? Because there will be no preferably it should be applied when the situation is cold and when the patient is going to sleep, so that all the kapha related things and all the impurities will come out, and it imparts the good eyesight. And it helps in the prevention of lifestyle induced eye disorders, and it helps in delaying of aging related eye conditions. And basically application of Saviranjana also helps to prevent the mode of, that is spread of infections to the eye. The next is Nasya, that is nasal installation. So this is application of medicines to the nose. And Ayurveda consider nose to be as the gateway of head. Why? Because you know that most of the eye serves to be as one of the paths or the ways where the infection can spread. into the body. So when we keep this, the nasal passage, when we maintain the healthiness of the nasal passage, we can prevent many diseases. So the importance that is being given is that is the nose is a gateway for the head. So by maintaining the healthiness of the nasal epithelium, we can prevent many diseases, especially that are related to the kapha. And especially the nasal installation of the medicine is being recommended in rainy season, autumn and spring season. So this is the season where most of the viral infections are being seen. So that's why, so when we put the nasal installations by using different oils, so that moistens the nasal epithelium and it attracts the infected material, so that later it dries up and it is blown out. So we can prevent the infections. Further, it helps in the prevention of the diseases of eyes, nose and ears, and it imparts the clarity in the sense organs. So it prevents the hair fall, induces good sleep, and it prevents the neurological conditions of head and neck. And basically, as discussed, it prevents the entry of particles into the nasal tracts, prevents the spread of infection to the nasal epithelium, and pratimarshan nasya, that is application of 2 drops of oil into the nasal, either by using the sesame oil or coconut oil. So probably this was also was recommended by the Ayush government as a prevention, one of the major preventive methods to prevent the COVID-19. So to improve the status, that is health of the nasal epithelium. So the pratimarshanasya with sesame oil or coconut oil is being recommended. Next, coming to that of the Gandusha Dharana. So this also helps in maintaining the health of the oral hygiene, and it prevents major the diseases related to the gums and throat. So here Gandusha is nothing but it's a mouthful of medical liquids. So it is like gargling or rinsing, or commonly we call it as the oil pulling. So here sesame oil is being recommended by the acharyas for oil pulling, and by doing the oil pulling by using the sesame oil, it strengthens the teeth, gums, jaws, and it strengthens the muscles of the cheek, face, on the jawbone, and it prevents the tooth decay, the bad breath, the halitosis, gingivitis, throat problems, and cracked lips. And basically, again, it subsides the kapha. So again, the bodhaka kapha will be corrected, and it helps in the taste perception. So even the lukewarm water added with the rock salt and turmeric can be used in order to cleanse it and to prevent the infections. And in one of the study conducted, oil pulling showed a reduction in the plaque index, modified gingival scores, and total colony count of aerobic organisms in the plaque of adolescents with the plaque-induced ginger. That is, the total colony count of the aerobic organisms had drastically come down in the plaques, that is, which induces the gingivitis. So oil pulling will help to maintain the health of the gums and to prevent most of the throat related problems. And next, coming to that of the massage. So daily massage is also been recommended by Ayurveda, and sesame oil is considered to be as the best for it. And either if a individual, if he is not able to practice the massage daily, at least he has to do once in 2 or 3 days. And the focus should be, especially Abhyanga, focus should be on the head, ear and feet. Why? Because they have their own effects. So Shiro Abhyanga, especially the head massage, prevents the premature hair graying, baldness. It strengthens the hair, it imparts the clarity in the senses, and moreover, the main important is that it induces the sleep and it corrects the insomnia, that is the sleep related problem. And further, foot massage has been also been recommended, where it reduces the cracks, the tiredness, contractures of the foot, stiffness, roughness, and it improves the eyesight. This is one of the unique benefits that has been told in Ayurveda, where foot massage is being told to improve the eyesight, where acharyas tell that there are 2 special nadis or the nerves which have a connection from the foot to that of the eye. So this is one logic that has been given by them to tell regarding that of the improvements in the eyesight through the foot massage. And especially it helps in the pacification of Vata and Kapha. So basically when we apply the oil, we apply to the skin, and skin is the organ of the touch. And the organ of the touch, that the skin, it is the main place where the Vata resides. And Vata is also the dosha which helps in the controlling of the mind. So it has a special connection of the perceiveness of the skin, that is the pleasure, the pleasure, it exerts a pleasure effect on the mind, and it helps in the soothing of the mind. So it helps to basically to prevent the Vata disorders, aging, easy fatigability. It improves the complexion, it improves the sleep, skin luster, and it helps to withstand the wear and tear, and it improves the tactile sensation and relaxes the mind. So basically that is the improvement in the tactile sensation through Vata, and it relaxes the mind. So studies have also suggested that massage helps in reducing the physiological measures of stress, including hormones which are responsible for the stress, like cortisols, epinephrine, and norepinephrine, and for a physical well-being. So that is especially the physical variables are also being the Abhyanga has the effect over the physical variables, where it helps in reducing the heart rate and the blood pressure. And one more study tells that massage activates the parasympathetic nervous system to slow down the heart rate and breathing, and relaxes the muscles and improves the digestion. So by practicing the massage, most of the Vata related, either it might be joint pains, or it might be the roughness of the skin, improve the sleep, etc., with to withstand the wear and tear, etc., improve the complications. So in this way, massage imparts a healthy living, so by which the immunity of the patient can improve. Next, coming to that of the Vyayama or exercise. So this is also one of the unique contribution, where every day we exercise, but to what extent we need to exercise, and when to stop the exercise, and what are the contraindication of exercise need to be given. So everybody exercise with their own goal, but when we exercise for a normal, to have a normal health, or uh, to maintain the health, so here an individual has to exercise to half of one capacity. He should not cross his half of his capacity. If he crosses, then that itself will work in inducing some injury to the body, which would affect in the later part of the life. So the massage especially, the Vyayama or the exercise especially, persons who are very strong, or persons who indulge in fat food daily in early winter and spring season, that early winter and spring season should aim to expend at least 50% of their body energy. Why? Because in this time, it is mainly in winter season and all, it is mainly a cold season, kapha pradhana. So the body will have good energy. So at that point of time, an individual to aim to expend around 50% of his body energy for the exercise. But on contrary, in summer, rainy, autumn, it should be aimed to spend less than that. Why? Because here the Vata will be more dominated, and if you over exercise, the Vata will get aggravated, and it results in different Vata related problems, like it might be the joint pain, the muscular pain, etc. And after exercise, one should gently massage his body. So gently has to massage his body to relax the muscles. And exercise induces lightness. It improves the ability for the hard work, digestion, reduces excess of fat, makes the body stable, and improves the physique. And especially exercise is contraindicated in aged children and in the status of indigestion. So in the status of indigestion, one should not do the exercise, and over exercise is contraindicated. So over exercise should not be done, where even studies have also given their own benefits and demerits about the moderate exercise and over exercises, where study found that moderate exercise shows an enhanced immunity level and may have fewer incidents of illness. So Ayurveda also recommends the same, that is to exercise to half of his capacity. And there is evidence that elite athletes who train at an intense level may have a higher risk of infection. And in the same study, it was found that, in another study, it was found that the marathon runners are more prone to upper respiratory tract infection during the periods when mileage is increased and in the 2 weeks following the run. So when they increase their mileage and after the run, within the 2 weeks of the run, they have a tendency, or they are prone for upper respiratory infection. So hence, moderate exercise are recommended. In that way, yoga is the best suited thing where individuals can practice yoga. So yoga has greater benefits and importance where it strengthens the body and the mind, it boosts the immune system, it lowers the blood lactate levels, and it reduces the anxiety. So if we exercise, we need to exercise according to the recommendation, that is half of the one capacity, according to the seasons, and according to its own strength. Next, coming to that of the Snana bath. So we know that this Snana is been routinely been done by every individual, but individuals taking bath time vary, but the variation in time should be avoided. So why? Because Ayurveda advocates Snana to be done in the early morning, and it considers the bath that is been taken in the early morning as Ayushya. That is, it imparts long life. And taking bath in the early morning enhances strength and complexion, and using water soaked with amla fruits prevents wrinkles and gray hairs. And one more thing, the unique contribution of Ayurveda that is being told is pouring hot water over the head is prohibited. So why? Because head is considered to be as the Uttamanga, and it is one of the vital parts. So pouring hot water. So most of the senses are located in the head region, and it causes it will lead to some problem to the senses. Hence, the hot water bath is being prevented. And cold water bath is good for eyes, and it prevents the vitiation of Rakta Pitta. Hence, cold water bath, cold water in the sense, the normal room temperature water has to be preferred for the head bath. So because of which it is very good for the eyes, and also it prevents the vitiation of Rakta and Pitta. So where most of the blood related, or which is more related to that of the eye related complications, etc. That's why that will be prevented. And this cold water bath should be avoided in early winter and spring season. So this is the season where an individual needs to avoid the cold water bath, and after bath one should use the fresh apparel. So everybody does it, but in order to prevent the infections, and it is also considered to be as auspicious to use a fresh apparel. And especially the bath is contraindicated after the intake of food and during indigestion status, and in people who have eye and ear disorders. And daily bath maintains the hygiene and it enhances the appetite. So it is being told that pouring hot water on the body, so pitta that has been located in the skin, that is Brajaka pitta, so that is the one which imparts the glow, etc. to the skin. So it influences the pitta in the stomach, that is Pachaka pitta, which is responsible for the digestion, and because of which there will be a good appetite and it enhances the digestion. And self-assessment of so there is a study so where the self-assessment self-assessment of health status with the visual analog scale, and the fatigue, the subjective health, skin condition, smile, and on the profile of mood status, it showed that immersion bath as a more advantage compared to that of the shower bath. So immersing in a tub as a tub bath has a greater advantage when compared to that of the shower bath. So it had shown a good improvements in the profile of mood status, in the visual analog scale, in the scale of fatigue, and in subjective health, skin condition, and smile. And similarly, one more study, it confirmed that hyperthermia by bath, that is by increasing the body temperature through bathing in hot spring, improve the cardiovascular functions and reduce inflammatory cytokines in patients with chronic heart failure. So this suggests that hot water bath to the body definitely has its own benefits in preventing many of the and in imparting the health and preventing the disease status. The next is coming to that of anulepana, vastradharana and gandhamalya dharana. So this is one we routinely do it, but wearing an appropriate apparel, etc., is what that is been stressed by Ayurveda. So here anulepana is use of natural perfumes like sandal, made out of sandal, or just applying the sandal paste, kesar paste, tulsi, jasmine, etc. So basically these serve as a mood elevator. It improves the complexion and they prevent the bad odor. And importance of for wearing a clean and a safe apparel has been stressed. And basically it imparts a good look, pleasure, grace, and it gives the competence in participating in the conferences. That is, especially when we go out to the many occasions when we are dressed very well, so that itself it gives a good look, and it gives a it creates its own impression. It gives a good impression. And Gandhamalya Dharana is to wear the symbols of festivity or auspiciousness or achievement, spirituality. So it boosts their self-confidence. So each of them, like if you take like a judge has his own code, and he has his own symbol of the achievement. And in the olden days, each of them used to wear their own symbol of either of achievements or spirituality. So this is what that has been highlighted. Basically, they serve as an auspicious and help to impart a pleasantness to the body and mind. Next, coming to that of Bojana or the eating habits, which is very much been stressed as, or which has been included as a part of Dinacharya for the maintenance of health. What should be the type of food that should we take? When should we take the food? To what extent the different types of food need to be taken, and certain rules regarding to be followed when we are having food. So the first and foremost thing that Acharya suggested that the meal should be taken when a person is hungry and when his previous meal is well digested. That is, the previous meal should be well digested and the person should have a hunger. So then only he has to take the food. Next, heavy to digest food, especially the food which are heavy to digest, should be taken to the half the capacity. So if a person has capacity to eat, excuse me, eat around 6 chapatis, so then half of the capacity to means he needs to eat only 3. Especially the food items that have been prepared by the black gram or usage of curds, cheese, wheat and non-vegetarian food, all these are considered to be as the heavy to digest food, which need to be taken to the half the capacity. And at the same time, we should not overeat the light to digest food. So you should not overeat the light to digest food. They should also to be taken in a lesser quantity in such a way that they do not hinder the capacity of digestion. That is, they should digest very easily. The food that we should consume should be warm. So that is, the freshly food should be always preferred. The overnight food or the reheated food should be avoided. So the food should be fresh, warm. It should be unctuous. That is, it should be unctuous. That is, some amount of ghee should be there in the present. So there is a, you all know the famous meal. That is, when homa is being done, we pour ghee, and by pouring ghee, the fire gets lightens up more. In similarly, a small amount of ghee that is being consumed along with food, it imparts nourishment, and it also helps to nourish the agni that is being present. That is the digestive fire. It nourishes and it helps in proper or easy digestion. The food that we consume in daily, it should contain all the 6 rasas in order to maintain. Why? Because each of the rasa has their own effect on the particular doshas. So like sweet, sour, and salt help in maintenance of the vata. So, and the pungent, the excuse me, the sour pungent and the salt taste helps in the maintenance of kapha, and the sweet, bitter, and the astringent taste helps in the maintenance of the kapha. On contrary, the opposite, they nourishes them. Like for example, sweet nourishes the kapha, the astringent nourishes the vata, and the sour taste nourishes the pitta. So entirely the balanced diet. So Ayurveda recommends balanced diet in the form of containing all the six rasas. Nowadays, when we talk about balanced diet, we tell that there should be this amount of carbohydrate, protein, fats, etc. But in those days, the concept of balanced diet was with that of the containing all the six rasas in our diet. The food should be taken with full concentration. So this is very much important. While having food, we should have a full concentration, and we should have a devotion towards that of the food. Why? Because Annam is taken to be as Annam Brahma, nan India. So it should not be neglected. Annam is taken to be as Brahma, and Chiyate Annadibihi, that the body gets the nourishment from the food. It constantly gets nourishes from the food. Hence, a full concentration should be given to the food. And especially when we take food, uh, the combination should be given very much more importance, like avoiding the combining antagonist food in property, like taking that is preparing mango, adding mango and milk. So this is the commonest thing that we find. But Ayurveda recommends usage of mango and milk as viruddha ahara. Why? Because mango is Ushnavirya, that is, it has a hot potency, whereas milk has a cold potency. So you're adding two contradictory things, which do not it affects immediately. Over a period of time, definitely it will affect the health. Taking equal quantity of honey and ghee, taking curd rice with fish, or taking milk and milk products with sour and salty articles. These are the certain things which need to be prevented, and do not eat hurriedly or very slowly. So in a moderate way, the patient, individual has to have food. Either he should not eat very hurriedly. Why? Because it will not help the food to mix properly with the saliva, and why? Because saliva helps in the digestion of the food. And while having food, one individual should not laugh, talk, or worry. But if then whatever all the benefits that the food has to impart to the body will be not will not happen. And the food should be heterogeneous. As told as earlier, it should contain all the six rasas, and homogeneous, that is using particularly one type of rasa, that is exclusively eating sweets, exclusively eating the pungent things or sour things is not recommended. Why? Because it leads to the vitiation of the particular dosha, as I told. Why? Because each of the taste influences their own dosha, and it will results in it results in the imbalance of the dosha, and it makes the person susceptible for the different disease status. That's why a balanced food in the terms of having all the shadrasas with six types of taste, with certain rules that have been told has to be followed in order to maintain the health. And after food, this is one of the concepts that we discussed, that is Tambulasevana. So there is a lot of misconception regarding the Tambulasevana. So by usage of tobacco. So Ayurveda doesn't recommend the usage of tobacco, where it is told to be as the Tambula, where it uses the betel leaves along with the substances which have been told here, like the lime, jatifala, kankola, karpura niryasa, that is camphor, kasturi, kadira, that is acacia, lavanga. It uses pugapala, that is areca nut, and the elytrata cardamom, that is elaki. It uses all these things. So when we see these ingredients, so most of them specify the vata and kapha. These ingredients help in the hoarseness of the voice, cold and cough. They possess bactericidal properties. They act as anti-emetic and enhance the power of digestion and prevents the bad breath. So especially taking this combination of tambula will serve as a post-meal digestive stimulant, and it is it acts as an aphrodisiac, mood elevator, and then as a nervine tonic. And a study has analyzed with these contents, the contents of Tambula, which has been told previously, and their the contents where it contains water, protein, fats, minerals, fibers, carbohydrate, vitamin C, A, thiamine, riboflavin, tannin, phosphorus, potassium, calcium, iron, iodine. Most of the essential the minerals are being seen in it, which help in boosting the immune system. Most of them help in imparting the health. They have their own health benefits. So traditionally, chewing of betel leaves, along with the ingredients mentioned in Ayurvedic classics, is very much safe and good for health. And excess usage of betel leaves and adding other ingredients for taste or palatability is the harmful thing that is happening today. Especially, particularly the tobacco and other harmful substances are dangerous, which need to be avoided. And these are the certain sadvrutta or the code of conduct that need to be practiced by an individual. So where Ayurveda describes certain codes of conduct called sadvrutta and large in detail compassing the following domains. So here I have compressed. So basically they have been told in the following domains like personal hygiene, regarding the verbal, regarding the social and behavioral conduct. So verbal conduct, social conduct, and behavioral conduct. So these mainly encompasses a wide range of moral virtues pertaining like being pleasant, courteous, exchange pleasant thoughts, and self-will, and it should be religious, and shed vices like jealousy, stealing, hatred, and insane. Instead pursue the virtues like courage, modesty, self facing aspirational, etc. And regarding that of these are the things that are related to that of the social and behavioral, and regarding that of the personal, he has told to keep the nails, facial hair, scalp hair, axillary trimmed off regularly, and he has also told that one should not sneeze, laugh, or yawn without covering his mouth. So this is the one thing that is now been advocated. So where we have been told to advise to cover, so in order to prevent the infections to spread. So all these were as a part of the code and conduct that were been given by our Ayurveda sages for the maintenance of health that need to be adapted in our daily regimen. So we may think all these procedure, how many, what would be the time that we will require? It may require a lot of time to this. No, when we get up in a Brahmi Muhurta, especially which is 90 minutes prior to that of the sunrise. So around 4:30, around 4:30. So it hardly requires around 2 hours. Like for Ushapana, it may requires around 3 minutes. For defecation, it requires around 15 minutes. Like face wash, Achamana, hand wash, it requires around 3 minutes. For brushing, 5 minutes. For tongue scraping, 2 minutes. For application of the medicated kajal, 3 minutes. Nasal installation with sesame oil, etc. for 5 minutes. For oil pulling, it takes around 5 minutes. Abhyanga, 20 minutes. So exercise around 30 minutes. For exercise yoga for 30 minutes. Snana, 10 minutes, that is bath. And for Anulepana and Vastradharana, it takes around 10 minutes. Bojana for 15 minutes and Tambula for 5 minutes. So around giving or following these daily regimens as spending 2 hours for this will impart health to us, and we will be able to maintain a balanced state of the bodily and the mind humors. So where it helps an individual to lead an healthy life, and which minimizes the susceptibility to the infections, and it has its own health benefits where most of them improves the immune system, and which is very much important, like adapting these type of a routine healthy regimens makes a person to defend the infections in these type of COVID scenario. So in the last, I would like to conclude this session with two slokas. That is, Naktam Dinadini me yanti katam bhutasya samprati dukkha bhanga bhavati evam nityam sannihata smriti. That is, a person who gives importance to the activities, what he does day and night, and he corrects them and he propers them followly, then that person will not suffer from dukkha, that is any diseases. And acharyas have given a simile to safeguard our body, that is nagari nagarasya eva rathasya eva rati yata swasharirasya medavi krutyeshu avihato bhave. That is, as a person who safeguards the city safeguards it, and as a person who rides the chariot safeguards and rides the chariot properly, an individual is responsible to take care. Swasharira, he himself, that is a Medavi, an intelligent person who knows how to follow these daily regimens, will give more importance to these things, and he will safeguard his body and he will maintain the health. So I think this session on daily regimen has benefited you, and I thank you for your patience listening. Thank you.
Thank you very much, Umesh sir, for your clear insights on how we should follow a daily regimen. So I think there are a few questions in the chat box regarding the Gandusha, I guess. Yeah. So in oil pulling, pulling refers to?
Oil pulling is that you need to pull the oil and you need to gargle. So either there are two types that is been told in the classics. That is, one is Gandusha is asanchari. That is, without moving the liquids, you can retain them for around 3 to 5 minutes, or you can take a you can fill your mouth partially with either with the oil or with that of the lukewarm water, which is been mixed with the rock salt and the turmeric, and you can gargle it and you can later spit it.
So in the context of the oral hygiene, to brush the teeth, so generally these days the toothpaste are supposed to have sodium lauryl sulfate, which is not good for our health. So instead, now recently there is a trend where they're suggesting the coal powder, yes, or the Saindavalavana, yes, or the rock salt to brush. How effective is that?
Saindavalavana is also one of the ingredients that has been advocated by Ayurveda for the brushing. So nowadays we are seeing many toothpaste with compare with the content of rock salt. So mainly the rock salt helps to prevent the gingivitis. So main thing is that the lavana, it has rock salt helps to clear the, especially the debris, the plaques, especially it helps to prevent the removal of the debris that has been plaques over the teeth and all. So that imparts the oral hygiene and helps to prevent the decaying, and also it imparts the gingival health. It helps to maintain the gingival health.
So it can be used instead of the
routine toothpaste. It can be definitely used.
Okay. And then in terms of Abhyanga, so sesame oil is the evergreen used oil, or you use different oils for different seasons, like for winter you use mustard, or for other season you might use coconut oil, or it's sesame oil?
No, sesame oil is told to be as the best. Why? Because sesame oil is anushna shita. So that is, it possesses both the property of hot potency and cold potency, and also it is both vata and kapha shamaka, and it is the best oil for the abhyanga that is being told. But according to even to the preferable season, especially when you could be go according to the different regions, even mustard oil is been also prepared, coconut oil is being used, and sesame also is being used. But sesame oil is the best oil that is being given in the classics for abhyanga. And when abhyanga as a part of daily regimen is told, sesame oil is being specially stressed in the context.
And then especially in the South Indian homes, we generally end the meal with curd or buttermilk. But there is also saying now that you shouldn't be, including milk products along with the meal, or they increase kapha, they increase drowsiness. So, what is your take on it?
So that's what I told you regarding that of the heavy to digest food articles and light. So where curd is a heavy to digest article that is being told. So we should see the combination of the food. So what are the properties of the ingredients of the food? So if most of them are heavy to digest, they should be taken to the half of the capacity. So then definitely, though we take curd at the end of the food, so it will not hinder the digestion. So it is being recommended we can take, but Ayurveda recommends like the food should be like it should be balanced in the form of containing all the rasas. And one main thing that has been contribution that is being given by Ayurveda is naktam na dadi bunja. So especially curd is contraindicated in night. Why? Because it blocks the channels and it increases the kapha in the night. As we are not going to do any activity in the night when we are going to sleep. So especially the curd is not advocated in the night. And also owing to the heavy property of the curd, Ayurveda recommends not to take exclusively curd. So Ayurveda is told either to add curd with amalaki churna or sharkara. We should add with the ambelica, that is amla powder or sugar, and then we need to take it. Then it will minimize the adverse effects of the curd.
Okay. So the curd, does it have any extra properties from the text of Ayurveda? Because they say that many people believe that curd kind of is a superfood.
Yes, curd. Most of the benefits regarding the curd has been told. So most of the benefits what the milk carries, the same benefits are also seen in that of the curd. But Ayurveda has seen curd has given the properties of the curd with reference to the different aspect of the curd. Like for example, the curd as a whole and curd where it is being churned in different proportions by adding the water. Like Uda speech we call the takra we call. So these type of that is that the curd that is being diluted with the different proportions of water has its own properties. But among them, when we compare curd, this is takra, that is the buttermilk is told to be as the best. So when compared to the curd, buttermilk is the best, so
best
takeable form. Why? Because buttermilk possesses both vata kapha shamaka, again it is anushna shita, and it is especially helps in digestion, and especially it is helpful in the disorders which are caused due to the faulty digestions, like either it might be a diarrhea, either it might be malabsorption syndrome, or even the hemorrhoids, piles and all. Ayurveda has recommended the takra, that is buttermilk, as a special diet.
What is the importance of 6 rasas in combination? Okay, which oil do you recommend for persons who suffer from allergy?
Allergy, it needs usually the common thing is that cooking oil. In previous day, what they used to do is the cold pressed oil was preferred. So the oils that were being used for cooking, both coconut oil and even the groundnut oil was being used. And most of the times when you see groundnut oil, especially the cold pressed oils were used. So I think the cold pressed oil, especially either it might be a coconut oil or it might be groundnut oil, I think they can be used, provided again allergy, it depends upon the body receiving the things. So I think the either coconut oil or the groundnut oil can be taken.
Importance of 6 rasas, I think you've already said.
Yes, 6 rasas, that is all the 6 rasas have their own importance. So as I told you that in the first stage of digestion in Avastapaka, that is, it nourishes the Kapha Dhatu. So where Madhura Rasa is very much important. In this next, the Pitta is nourished, where Amla Rasa is important. And Kapha is, lastly, Vata is there, where Kashaya is very much important. And antagonistically, in order to maintain the balance, again, the other Rasa works on them. So a balanced the diet in the form of containing all the 6 rasas will help for the balancing of these three doshas and to impart the health.
So I think we're done with the questions. So I thank you all for joining us in this program. So we'll again see you the next week. Okay. So the next session, we will have it on 15th of August. The next Saturday being a second Saturday will be a holiday. So the next session would be on 15th of August. So we hope to see you all on 15th of August for the next session. Thank you and have a beautiful day ahead.
Thank you.